Hi, good afternoon and Assalamualaikum. Today we are from the group number 5. Would like to present the assignment for the lab safety subject. So the topic of our assignment is what is the first aid for convulsion. So the group members are Muhammad Aminuddin bin Said, Hakami Mona Hamad, and Tuan Nurul Azura binti Tuan Kopiak or Elias Yaakob. What is a convulsion? Convulsion is a general term that people use to describe uncontrollable muscle contraction. Some people may use it interchangeably with the word seizure, although a seizure refers to the electrical disturbance in the brain. About 1 of 10 people may have seizure during his or her lifetime. That means seizures are common and one day you might need to help someone during or after a seizure. Epileptic seizures can be divided into types, which is focal seizures and generalized seizures. Seizures can vary from one person to another person affected, and how they are recovered after seizures varies. How many types of the seizure? Seizure consists of the 4 types. One is epileptic seizures. Number 2 is febrile seizures. Number 3 is non-epileptic seizures. And number 4 is paroxysmal kinesiogenic dyskinesias seizures. So the definition of epileptic seizures are electrical is disturbance to the brain. The most common type is called tonic-clonic seizures. The tonic means a stiffening while clonic means jerking. This movement describes the primary characteristic of the seizure. What is definition of febrile seizures? Febrile seizures can affect the children between the age of 6 months and 5 years who are experiencing a fever. How about the non-epileptic seizures? This is mean they occur due to the mental or emotional stress. And last one is paroxysmal kinesiogenic dyskinesia seizures. This happen for the person experience a sudden motion such as being startled or standing up. How to diagnose the seizures? So the standard test that the doctor used to diagnose epilepsy or seizures is by using the electroencephalogram or EEG, in which they are attached electrode to the person's scalp to record the electrical activity in the brain. An EEG can reveal whether there is any unusual activity at the brain. The pattern that Dr. Yos observed can point to the type or types of seizures someone experienced. If doctor cannot successfully diagnose a atonic seizure from the observed information and the EEG result, they may need to perform the further tests that check for the changes in the blood pressure or heart rhythm. The physician can use CT and MRI scan to determine the location of the seizures. This can help to rule out any potential cause of seizures such as a stroke. What is the symptom of the convulsion? The symptom of convulsion is lack of awareness or loss of consciousness, eye rolling back in the head, face that appear red or blue, changes to the breathing, stiffening of the arm, leg, or whole body, jerking movement of the arms, leg, body, or head, and lack of control over movement.
Hi everyone. There isn't much you do to stop seizure once it starts, but there are some steps you can take to protect someone from harm during a seizure, such as ease the person to the floor, turn the person gently onto one side. This will help the person breathe. Clear the area around the person of anything hard or sharp. This can prevent injury. Put something soft and flat under his head. Remove eyeglasses and loosen ties or anything around the neck. Last but not least, call 999 if the seizure lasts longer than 5 minutes. Let's move to another slide. It's also important to know What not to do during the seizure. Do not hold the person down or try to stop his movement. Do not put anything in the person's mouth, because this can injure teeth or the jaw. Do not try to give mouth to mouth breath like CPR. People usually start breathing again on their own after a seizure. Finally, do not offer the person water or food until he is fully alert. Let's move to another slide. Here are some precautions to avoid injury. Work with a partner, take vitamins, to eat properly and fully. Do not neglect physical exertion. Before going to bed, massage feet. And some people choose to wear a specially designed medical alert bracelet or pendant with the epilepsy information in case of an accident. Another option is to carry medical information in your wallet. That's me at the end of my talk. So now I will hand it over to my friend.
Thank you, Mona. So I will proceed. Okay, when should we call an ambulance if someone that we know having a seizure? Actually, we doesn't need to call ambulance every time the person having a seizure. Okay, why? Because usually people who having a seizure will recover themselves after the seizure end. But just in case, if the seizure lasts longer than 5 minutes, so that's the right time that we should call an ambulance. Okay, other than that, we also should call an ambulance immediately if the second seizure quickly follows after the first one, and also if the person that we know having a seizure is not responding more than 5 minutes after the seizures end, so we must call an ambulance. Okay, other than that, we also must call an ambulance if the person that are having a seizure are difficult to breathe after the jerking stop. And also we also must call the ambulance if we know that the person who having the seizure, it is their first time seizure, which means that they have never had any seizures before. Okay, and then other than that, we also must call the ambulance if the seizure occurs in water. Why? Because if the seizure occur in water, the water might get into the person's lung, which is it is very dangerous to the person itself. Okay, besides that, we also must call an ambulance if the person is injured or hurt, because as we already know, if the person having seizure, they might fall during the seizure, or so maybe the person hurt their head or hurt their body. Okay, and then last but not least, we must call the ambulance if you are in doubt, which means that you are not sure whether the person is in a good condition or the person hurt. So you must call an ambulance for that. Have you ever heard about sudden unexpected death in epilepsy? Okay, sudden unexpected death in epilepsy usually occur due to the uncontrolled and frequent seizures that occur in a person. Okay, if you are having a seizure, make sure that you get the best seizure control possible to avoid the sudden unexpected death. Okay, make sure you take your medication as prescribed. Speak to your doctor if you are not happy with current medication or you're not happy with the side effect. Okay, and then make sure that you have regular reviews with your doctor so that the doctor can advise you and they can help you to control the seizures. Okay, other than that, make sure that you are be involved in the self-management. You must avoid any non-seizures triggers for you. And then if you are alcoholic, make sure you avoid drinking too much alcohol. Know yourself better, which means that you must know when your seizures are most likely to occur, so that you know what to do when the seizures occur. Get enough sleep, be healthy, which is exercise regularly, and make sure you know how to manage your own stress. Okay. And last but not least, make sure those who close to you or your friend or your family know what to do in case of a seizures occur. Okay, that's why it is very important for us to know basic uh, emergency aid to do if people who close to us are having a seizure, because we can help them and also we can save their life if the seizures occur. Okay, I think that's all from our group. Okay, so this is our references. Okay, thank you for your time and attention.